Barely showing and you are wondering if everything is okay. Like, this is something which has been asked to me like so many times, and I'm talking about this is asked to me in first trimester, second trimester, third trimester, every time. And my answer is always like, what do you mean you're barely showing? Like, you don't show, okay, at different points, and it's a very subjective thing when this showing is talked about. So most of the times it's either people who have told you that you're not showing, or you yourself are looking for it, right? So what does it mean is, like, sometimes, like, I personally experienced the moment I got pregnant, suddenly the lower area of my tummy was like roundish. Okay, this is what my perception was. It doesn't mean it's like changing. It's like suddenly my eyes started looking for the roundness. And you do change, because that there is little bump which is coming up, little subtle change is happening. But that's very subtle. The only thing which is growing inside is your uterus. And the uterus in first trimester is like this much. Normal size of the uterus is the size of your fist. So as your pregnancy is growing, it literally crosses, it goes from your pelvis, which is, pelvis is like till here, like literally where your bladder is, okay, that area, and it comes into your abdomen after 12 weeks. It doesn't come before that. It's still like very much inside. Now, so you will not probably show, say, till first trimester is over. And after that also, it will like subtly, you will start seeing the shape of your tummy change, say after 14-15 weeks, like slightly. And it starts showing little bit by 5 months, 20 weeks, and then it will start growing up. And then your uterus will keep growing every month, and you can never objectively know how much you're growing. But we have measurements, like we use a tape and we go from the fundal height to the symphysis pubis, and that can also be very subjective, but we use that as an assessment to measure the size of the pregnancy. Now, it can vary for patients who are thin, and it can be different for patients who are obese. So the thin patients might show easily if they're wearing tight clothes, but even they might not. Especially if you're in a Muslim country where you wear abayas and stuff, no one can tell if you're pregnant, right? So, but obese patients, it has happened so many times that we get confused between a patient who's slightly big and she's not pregnant, but we think she's pregnant. So, whether you're showing, whether you're not showing is like completely subjective. It doesn't mean anything. The only way to know if you're pregnant and you're growing okay is when you go to your doctor's visit. But our minds are like, we want to know if we are doing the right thing always. We are always constantly thinking about, am I doing the right thing? Am I growing? Is my baby growing? All of those questions generally have two answers. Either it will be like, yes, of course I'm doing everything right, or it can be like, no, I'm not doing anything right. Now, if you think, yes, of course I'm doing everything right, it will just keep you believing that you're doing everything right. And the results, the actions that you take, the results that you create is like, you do the right things and everything turns out to be wonderful. But if you start thinking, no, I'm doing something wrong, you go to your doctors, you start checking, asking for things to be checked, and then we find weird things which we were not supposed to be found, and then we do some more tests, and all of that anxiety, it will just ruin your experience of being pregnant. So, you have an option to believe everything is going perfectly. You are the best mom to your kid. You are doing the best things that you can do. And you can choose to believe that every day. So when someone comes and tells you you're not showing, you'll be like, I think I'm showing. Don't you see it? You can always say that.